Today we're talking about hypertension, also known as high blood pressure. You will learn what it is, what the numbers mean, and how to follow blood pressure parameters safely when giving medications. This video is only part of your nurse delegation training, and it's meant to support your in-person instruction, not replace it. It is not medical advice, so please always follow the specific instructions provided by the delegating nurse assigned to your client. Their directions always take priority over any information presented here. Blood pressure is the force of blood against the walls of the arteries. Arteries are the blood vessels that carry blood from the heart to the rest of the body. It's recorded as two numbers. The top number, called systolic, is the pressure when the heart beats. The bottom number, called diastolic, is the pressure when the heart rests between beats. Hypertension means the blood pressure is too high for too long. This puts strain on the heart, and it can damage the blood vessels, kidneys, and brain over time. It's often called the silent killer because many people don't have symptoms. Even so, untreated high blood pressure can lead to serious outcomes such as heart attack, stroke, and kidney failure. This is why monitoring and managing it is so important, even when the client feels fine. According to the American Heart Association and the American College of Cardiology, a normal blood pressure is less than 120/80. A hypertensive crisis is a medical emergency. This is defined as a blood pressure reading of 180/120 or higher. The appropriate response depends on the client's individualized care plan. Some care plans may direct you to call 911 immediately, while others may instruct you to contact the physician, the hospice nurse, or the delegating nurse. Always follow the client's specific care plan instructions. If the client shows signs of chest pain, shortness of breath, severe headache, vision changes, confusion, or other signs of distress, call 911 immediately unless the care plan states otherwise. While 120/80 is considered normal in general, each person's target range can vary based on their health conditions and medical orders. That's why caregivers must only follow the specific parameters provided in the client-specific care plan or delegation paperwork. Never guess or use numbers from a different client. Always check the MAR or the delegation instructions to know when to give or hold medications and when to notify the nurse. If you are ever unsure, ask for clarification before proceeding. Some medications that are used to lower blood pressure can make it drop too low if they're not used correctly. Because of this, you may be instructed to check the blood pressure before giving certain medications. If the pressure is below a set number, you must hold the medication. For example, a care plan might state, hold the medication if the systolic is below 100 or the diastolic is below 60. This means if the top number is under 100 or the bottom number is under 60, you should not give the medication. Instead, you must contact the nurse and document what happened. This helps protect the client from low blood pressure, also called hypotension. This can cause dizziness, weakness, fainting, and dangerous falls. It's also important to watch for signs of dangerously high blood pressure, such as headache, blurred vision, nosebleeds, or feeling flushed or hot. If a client loses consciousness, experiences chest pain, or cannot speak or move, call 911 immediately unless you've been otherwise instructed to do so. If the client is on hospice, please be sure that you know the chain of command when calling during an emergency. As a caregiver working under delegation, you are expected to take accurate blood pressure readings. Be sure to know if the medical provider is asking for manual or automatic blood pressures. You must know the hold parameters for medications and document the blood pressure, what medication you gave or held, and why. Never guess or make decisions outside of what is written in the care plan. If you don't know what to do, stop and call your nurse. Thank you for your careful attention and for the essential care that you provide every day. If you would like to get more confident in your manual blood pressure skills, ask your delegating nurse for help. We are here for you as well as the client. We want you to succeed. We want to help you understand when to call the nurse or 911 when needed, and never hesitate to ask questions.